Well, the world has a drug problem. That is the conclusion of a new report from the United Nations. It says that the number of people using drugs globally has increased by 20% in the past decade. The trend is expected to continue, especially in Africa. The number of people taking drugs there is projected to rise by 10% in the next 10 years. The coronavirus pandemic has led to more drug use around the world. Lockdowns and travel restrictions have forced dealers to find new ways to sell and deliver their drugs. Cannabis, or marijuana, remains the most widely used drug, and it's stronger than ever before. The UN says more and more young people are unaware of the potential health risks. Well, Afghanistan is home to the global heroin trade. For the down and out in the capital, Kabul, drugs seem like an easy escape from their difficulties. In our next report, we meet a woman determined to help users break the cycle of addiction.
Earrings and sneakers on, and Laila Haidari is on her way to Mother Camp. It is one of the few privately run addiction facilities in Kabul. Haidari founded Mother Camp. On her way, she passes by Polisokta Bridge, where many drug addicts live.
When I saw the bridge for the first time, it was like looking straight into hell. I thought, this is what hell looks like. People were lying on the ground like animals. They were dying. And they could have had promising lives, become doctors maybe.
There was another shock in store for Haidari. She hadn't seen her brother for a long time and found out that he was living under that bridge. Haidari decided to take action. She wanted to help her brother and the many other addicts in Kabul. Almost everyone in the city of 4.5 million knows someone whose life has been destroyed by drugs. Her rehabilitation center is located in western Kabul. Ustad Hassan was once an addict himself. For 30 years he suffered from heroin dependency. But with Haidari's help, he managed to kick the habit. Now he manages the center in her absence. Umid is not an addict. He has been here ever since Haidari found him as a young child in a garbage can on the side of the street, most likely abandoned by his family. Patients stay here for about 4 weeks. There is a lack of costly medicines to ease their withdrawal symptoms, so patients usually have to make do with cold showers. They also have a lot of talks and music sessions. Haidari also has in mind the time after the rehab. She also runs the restaurant Taj Begum. All employees are recovered addicts. The work helps them lead drug-free lives and brings new perspectives. Mohammed Hussein is one of those who managed to turn his life around.
This is a special place for Afghanistan. We can feel pretty safe here. I'm very happy to work in this place, because here, in the restaurant, it's just different, almost like a family.
Some take offense to the venue. The restaurant receives threats from extremists also because it is run by a woman. Haidari has managed to build what she set out to build, but the situation in Afghanistan is unstable. The withdrawal of international troops is underway and should be complete within the next few weeks.
I'm pretty pessimistic about Afghanistan's future. It seems hopeless. The only ones who can look confidently towards the future are the Taliban, radical Muslims and their adherents, not Afghani women.
The future is uncertain, but at least for now, Laila Haidari knows what she is going to do: support those with drug addiction in Kabul for as long as possible.
Let's get more. We are joined by Angela Mee. She is Chief of Research at the United Nations Office on Drugs and Crime that just released the UN Drug Report of 2021. Thank you so much for joining us. We've just seen a little bit more about the situation in Afghanistan, but of course, you know, this is a global situation. Africa, for example, seeing a projected rise of 40% in the next 10 years. How alarming is this?
Well, it's alarming, particularly for Africa, because 40% more of people who use drugs means 40% more of the needs of treatment facilities in a region where currently there are already critical gaps in providing treatment. There is also alarming because more drug users means a larger drug market, and so more drugs trafficking, more drug production possibly, and therefore also more instability, because we have seen on how drug markets can also bring instability in the region.
I'm wondering why this is happening now, and wondering, you know, if you could maybe shed some light on this. Does the pandemic, for example, have anything to do with the rise in drug use around the world?
Well, the pandemic has affected the drug use in two ways. One, directly. So during the pandemic, we have seen now almost in all regions of the world an increase on certain drugs, particularly the use of cannabis and the non-medical use of pharmaceuticals. While the decrease of other drugs, particularly those that have been used socially, like ecstasy or also cocaine and other stimulants. But where also the pandemic will likely affect drug use is more in the long term. As we all know well, the pandemic has brought poverty. More people have entered poverty during the pandemic globally. More people have lost jobs, and many students have been left out from school for almost 2 years. And we know that low education, poverty, and unemployment are risk factors for drug users. So this is likely to increase in the future.
And probably also a feeling of hopelessness among many. You mentioned cannabis use, for example, and I'd like to ask you a little bit more about that. The UN report also finding that cannabis products are stronger than ever, while many young people underestimate the harm that they do. How dangerous is that?
Well, it's dangerous because the use of drugs in general is particularly risky for young people, because we know now there is medical research that shows how the brain developed until 24, 25 years, until a person is 24 or 25 years. And so until there is this development, drug use can really affect even in a more negative way that within the adult. And the idea that young people don't have a perception of the real harm that cannabis use is definitely affecting their health. We know, again, research is clear that the regular use of cannabis produce psychosis, produce mental health disorder, loss of memory. So something that clearly has a negative effect on the youth.
And really interesting, because we see, you know, in some parts of the world, cannabis increasingly being legalized as well. So something for everyone really to keep in mind is that warning that you're coming out with today. Angela Mee, Chief of Research at the United Nations Office on Drugs and Crime. As we've mentioned, you've just released the UN Drug Report for 2021, and we thank you so much for joining us here on DW to tell us more about it.
Thank you. Thank you.